Good evening to all present here. It's my greatest pleasure to welcome you for this webinar. Thank you for taking your time and efforts to be part of this webinar and conference on this year's Blood Donor Day. On behalf of our team at Nurseslabs, I would like to welcome you all again. We especially welcome all those who are joining us for the first time. Do continue to engage with us and keep yourselves updated for more information. Let me introduce to you Nurseslabs. This is a platform where nurses come to not only gain knowledge but to inculcate professional skills. This blog helps all in need students, nurses, administrators. Anyone can benefit from Nurseslabs. It's your one stop destination for all your nursing needs. Please do follow us on the following platforms. We have a WhatsApp channel and Facebook page, YouTube, along with Instagram. Please note, keep all your devices and audios on mute at all times during this webinar. I would like to take the privilege of introducing our speakers for this evening. Our first speaker would be Mrs. Anbeshwari. She will be talking on the theme Blood Donation and Global Health. We are honored to introduce her. Ms. Anbeshwari is a distinguished nursing professional with an exceptional blend of academic excellence, clinical expertise, and teaching experience. Ms. Anbeshwari has completed her undergraduate nursing degree from the prestigious College of Nursing, Madras, Chennai. She went on to pursue her postgraduate studies at Madha College of Nursing, Tamil Nadu. With an impressive 18 years of experience spanning both clinical and nursing education, she has significantly contributed to healthcare sector in South India. Her career includes roles as a lecturer, physician assistant in general medicine, and nursing officer. Her specialized departments including cardiothoracic operation theatre, maternity care, and community health. Her expertise and leadership extended to her role as a treatment organizer for the district TB center, and currently she serves with dedication as an in-charge officer of the emergency department at Government Hospital, Hosur. Ms. Anbeshwari is a passionate academic and researcher. She has 10 research publications in reputed journals like Scopus and Web of Science Index journals. She has presented numerous papers at national conferences and webinars, particularly on clinical-oriented topics relevant to modern nursing practice. Known for her academic brilliance, she was a topper and exceptionally studious during her formative years. Qualities that continue to reflect in her professional journey. We welcome you, ma'am, and it's over to you.
Thank you, Nurseslab. A very good evening to all. I extend my sincere thanks to the Nurseslab for organizing this webinar. And it is, of course, a very good topic, and that has to be selected on this day of World Blood Donors Day. And I'm happy to present my topic. Is it audible to everyone? In this topic, we are going to cover the global key facts and the different types of blood donors, global usage pattern of blood donation, and a few facts of blood donation in India, and medical uses of blood, a few misconceptions regarding blood donations, and what are the challenges we are facing nowadays, and few case scenario. Of course, we know that blood donation is a critical component of global health, which enables safe blood transfusion for a wide range of medical needs, which starting from emergency situations to manage chronic illnesses. Today, World Blood Donor Day, the theme of this year is Give Blood, Give Hope, Together we can save lives. We all know there is no substitute for blood, and there is no artificial blood also. The only way to generate blood is by the own body only. And moreover, we can supplement the blood reserve is only by blood donation. Approximately 350 ml of blood is being drawn from the donor, and the donor also get this blood, donated blood, which gets replenished in a body with a normal diet. The plasma get replenished within 48 hours, and the cells like RBCs, WBCs, and which could be replenished within 4 to 8 weeks of time. Blood donation can save lives. Of course, it is a noble act. Man can donate blood every 3 months, whereas women after 4 months. Blood donation is not accepted from people those who are suffering from HIV, hepatitis B, C, venereal diseases, or any other known communicable diseases. If you see the global key facts, 31.5% donations are happening in high-income countries, whereas half of it's like 16.4 donations in upper middle-income countries, 66.6% donations happening in lower middle-income countries, and only 5% donations in low-income countries. If we see in the high-income countries, most of the transfusions are being used for people over 60 years of age, which is approximately 76% of blood donations are used in high-income countries. Whereas in the low-income countries, up to 54% of blood donations, blood transfusions are given to the children under 5 years of age. There are 3 types of blood donors: voluntary and unpaid donors, family or replacement donors, and paid donors. The report from 2008 to 2018 has given that an increase of 10.5 million blood donations has been taken from the voluntary unpaid donors. In 79 countries, 90% of their blood supply is from voluntary unpaid blood donors. In 54 countries, more than 50% of the blood is supplied from the family or by the replacement method or by the paid donors. This is a report from WHO of 2020. If we see the low and middle income countries, 75% of donor population is male, while 42% of blood donation is globally happening from women, which is about 10 to 20%. Women, especially those who are in the reproductive age, often have the lower blood hemoglobin. So, which is maybe due to menstruation, pregnancy, or nutritional issues. They are often leading to donation deferrals. So, we are in a situation that we are not able to draw much blood from women naturally. And if you see the annual transfusions, approximately 85 million units of RBCs are transfused worldwide every year. In high-income countries, blood products are mostly used for advanced medical and surgical procedures, including cancer treatments, hematological problems, trauma care, cardiovascular surgeries, and orthopedic surgeries like that, and also organ transplants. Whereas in case of low-income countries, large proportion of blood is used for treating obstetrical emergencies, severe anemia in children, which may be due to malaria and malnutrition. So we can compare how far the blood is used in high-income countries and low-income countries. In India, approximately 12 to 15 million units of blood are needed annually. However, there is a shortfall in supply. India faces 10 to 15% of shortage, especially in rural and tribal areas, which has been reported by National AIDS Control Organization of India. Over 80% donations nowadays coming from the voluntary unpaid donors, which we can see the significant improvement compared to the year of 2007 to till date. It is from 54%, it rose up to 80% from the voluntary blood donors. And very interestingly, 60% of blood donors in India are ranged or age group as between 18 to 35 years. Of course, it is a welcoming trend in India. Now we see the medical uses of blood. Trauma and emergency cases, blood are mostly used nowadays, which is a very important vital thing. which needs to save the blood. Blood transfusions are critical in managing severe cases, which helps to minimize the death and disability in injured patients. We are using blood for complex surgery procedures like cardiovascular surgeries, organ transplants, which often require blood support. For cancer patients also, we need blood supportive care, those who are undergoing chemotherapy or radiation therapy. When we see the maternal care services, it has been noted more than 5,30,000 women die each year during pregnancy time, childbirth, or during the postpartum period due to PPH. So those set of category people, they need a good amount of blood transfusion. Patients with blood disorders like sickle cell anemia, thalassemia, or regular, these patients, those who are they are routinely depending on the blood transfusions, they need to manage their health and improve the quality of life. We see the few facts about the blood donation. There are a lot of myths happening in this blood donation. Blood donation makes you sick or it makes you weak. Whereas the fact is, blood replaces the lost blood within few days. Most people feel normal after rest and dehydration. It's not a much thing that people will fall sick or weak after blood donation. Then you can get infected like HIV infection from donating blood. Of course, it is not, because we are using the sterile disposable needle for using the draining, like bleeding the blood. So there is no risk of infection. And another thing is, women should not donate blood. It's not so. Women can safely donate blood provided they are meeting the health criteria and they are fit for blood donation. But most of the time, women are deferred due to low hemoglobin. So based on the eligibility criteria, if they are fit enough, they can donate blood. You need to be on fasting before donation. Of course, it is not. The donor has to eat good healthy meal and drink good amount of water before donating, so that they do not feel sick or dizziness. Only adult can donate blood. It is not people those who are, older adults could not donate blood. People those who are age more than 65 years also, they can donate blood if they are healthy. People with tattoos can't donate. It is also not so. They can donate provided if they have done tattoo with the licensed facility and the wound is also healed properly. So they can usually donate blood after 6 months, and it also depends on the criteria which has been followed by the particular bank or the institution. Frequent donations are harmful. Of course, it is not. Donation intervals are regulated. So every 3 months once, men can donate blood, and every 4 months, women can safely donate blood. Another myth is only rare blood groups are needed. It is not so. All blood types are needed regularly, especially O negative. We are needing much amount, because it is in the critical time when no other blood groups are available. They are using this O negative. Of course, it is the universal donor. You can't donate if you're on medication. Again, it is also depends on the type of the medication the patient is taking or the donor is taking. Many common drugs do not disqualify the donors. So this can be clarified at the blood bank. And if the patient is fit enough, they can donate blood. One blood donation can't much make a difference. It is absolutely not, because one donation can save up to 3 lives, because we take different products from the single donated blood. We all know this is all used with different patients and for different purposes. Now we see this topic of challenges in blood donation globally. There are a lot of shortages happening, and again, the demand is also high. 18.5 million blood donations are collected globally every year, but more than 40% of are that from the high income country, which represent only 16% of the world population. In the low middle income countries, blood donations are low as 4 donations from 1,000 population, whereas it is compared to 33 donations per 1,000 population in high income countries. We can see the much difference. Whereas low country, there are only 4 out of 1,000, whereas high income country, there are 33 out of 1,000 population. The demand in the low middle income countries are more due to high maternal mortality rate, road traffic injuries, and also infectious diseases. So these type of medical emergencies need high blood transfusions in low middle income countries, whereas in the high income countries already we have seen those are used for surgeries and the better life. Another challenge is the infrastructure issues in low resource setting. Many countries lack adequate blood storage facility. The not possibility of maintaining cold chain system and transportation is also a problem. They are not able to maintain the cold chain system. World Health Organization reports noted that only 56 countries have national blood policies which are set in gold standard. They are following that, and fewer than 50 tests are done on donated blood for common infections like HIV, hepatitis B and C, syphilis. So many of the low-income countries, it's not a thing that all the blood are screened for all infections. And lack of trained personnel and underfunded health system is also an important challenge, which again limit the capacity for safe blood donation and transfusion. Misinformation and donor fear. There are many cultural myths like donating blood causes weakness or infertility, which contribute to low donor turnout. It is another problem that has been faced by the younger age group. In part of Africa and Southeast Asia, the problem is with the fear of needles and the sterility issues, and again the religious taboos that reduce the willingness to donate the blood. A study from India in the year of 2023, it shows that over 60% of the first-time donors expressed the fear or uncertainty due to lack of awareness and education on the process. They have a lot of questions on how it has been processed. The few challenges again are safety and screening limitations. Blood safety remains another important concern. Over 13 millions of units globally are not properly screened for one or more infectious markers. WHO data shows that 16 countries still do not test for all donations for transfusion transmissible infections. That is the challenge we are facing. I had already told there are a lot of countries, still there are setbacks that all the blood are not screened for all infections. It is really a dangerous to hear. Unsafe transfusion practices are still result in 70 to 80,000 HIV infections annually and the higher risks for hepatitis B and C. Though there are a lot of challenges happening in the blood transfusion, there are still, it is a very vital component in our field. Without blood transfusion, there are many surgeries and many life-saving measures could not be done. And here we have some success story. In 2020, Lagos in Nigeria, voluntary blood donors have came in mass number to save the life of people, those who have been the victim of gas explosion. So there are a lot of people came forward to save the lives of the people, those who have been injured in this gas explosion. This is a remarkable trend, which remarkable incident happened in 2020, saved much people, more than 260. Another incident which happened in India, in the year of 2022 in Odisha, local health department and voluntary blood donors group have expressed this incident. Of course, we are all daily facing this sort of incident. Like, though, if we are in the medical health sector, of course, it is in the proper hospital setup, we are able to get blood, and it's not much difficult for us to get the blood. But people, those who are in the remote areas and tribal areas, getting blood transfusion, blood is, of course, a very uh, tedious one where not able to get in time and chances for to lose the patients also. Here it is a history in the Ganjam district of Odisha. A person has delivered a baby at the community health center, but she had undergone postpartum hemorrhage. That they need immediate blood transfusion. But the opportunity for her to get the blood is almost 100 meters, kilometers away. So they have arranged local blood donors, and they have communicated with a lot of people to get the blood. And finally, they have reached through NGOs and WhatsApp group. Within 2 hours, they had obtained this adequate number of blood transfusions, and they saved the life of the women, and also the baby is also good now. So it shows that getting blood in the higher centers and the city, it is easy. The main challenge is saving the life of a patient, those who are in the remote area and tribal, unreachable area. It is the real challenging, and they also need immediate blood transfusion. So after this incident, they had created a dedicated rural blood donor network, and they also created campaigns on educating the public regarding maternal health and blood donation, the local recognition for the volunteers, and this has inspired many youth to join those group. And this is a few glimpses of my hospital. Today, we had a blood donation camp. Many people have interestingly donated, and the government has initiated this 104 number, which has been used for many purposes. Now it has been for the blood donation also, like blood on call. If we need a blood, we can dial 104 and we say our location. If it is around 40 kilometers radius reach, we can arrange the blood within 4 hours. So it is the newer thing today. It has been added with this 104, like blood on call. I thank everyone for participating this webinar. Thank you, Nurseslab.
Thank you, ma'am, for your intensive presentation. It was definitely, it busted all the myths and sticking to the facts about blood donation. Thank you for your presentation. We will move on to the next presentation. I'll introduce the speaker. Mr. Benji Foscablo. He's working in Singapore currently. He's a founder and convener of the Filipino Nurses International Association in Singapore. He has completed his master's in business administration from the Filipino Business School of Administration. He is a registered certified practicing nurse under the Singapore Nursing Board. Mr. Benji is an expert in content creation and blogging. He is an excellent media resource person. As a nurse leader representing healthcare workers, he is a public speaker for health education, health advocacies, and health reforms. He is also an exceptional motivational speaker for community groups, aspiring nurses, and future professionals. We gladly welcome you, sir, for this webinar on this year's World Blood Donor Day. Over to you, sir.
Yeah, hello, good evening, everyone. And I hope my audio and my slide is clear. Yeah, thank you for this opportunity to be speaking in this momentous event. And of course, with the talents of the Nurseslab and the team and the leadership of the founder, I was able to be in this uh, celebration. Yeah, I guess we're celebrating for the World Blood Donor Day for this year 2025. And as introduced, yes, I am Nurse Bench. I was also um, get the chance of being elected as the president of the Rotary International. So this one is from the District 3780. Some of you might be familiar about the Rotary. This is a non-government organization which serves the community, regardless of the race, the color, the gender, and it's more about the humanitarian effort. So there, we have a bloodletting activity, or in the community, we encourage also blood donations. In a hospital, if DC, like if you see in the screen, the hospital with a red light. So this one, that means that if you see the red light in the hospital, that means that these hospitals, that the blood supply is low. And we need more blood donors, or we need more bloods. So it's a good indication that, like for example, we are passing by in in this hospital. So we can help not only our loved ones, not only our family, but someone who needs a blood in terms of, medical crisis, or in terms of medical needs that some of our patients or some of our loved ones are in need. So this one is from Makati Medical Center. So when the low blood supply and urgently needs of donors, the hospital indicated a flashing of red lights coming from the hospital building. So you can just, if you're dropping by, you can just see the red light, and that means you are in need. You are in need, and your blood is in need, because some patients are in need of your blood. In accordance with this celebration, it started. I just want to share, or I just want to give wait I want to share, or just give a preview of some of the themes that uh our celebration is worth to celebrate with. So like I just start in the 2020th. The theme of the Blood Donation Day is the Safe Blood Saves Life. Even during pandemic, the 2020 theme for Blood Donation Day, um the slogan of Blood Donation Day was the world healthier, or is to give blood to make the world a healthier place. So this year's the World Health Organization announced virtually uh or virtually rally during the COVID-19 pandemic. So blood donors helped so with all the patients' ages to get better and stay alive. So we moved to 2021. So on the 2021, the theme, or sorry, before that, so okay, way back on the 2020th theme. So we're encouraging a lot of donors to give bloods, or a lot of people in the community to give blood to help patients and health workers. Also, to ensure the safety and measures are in place, physical and distancing and the hygiene. So while, of course, even though we do this kind of activity, of course, we're making sure that everyone is safe, and also encourage people to keep donating blood and give blood to save lives and give safety. So moving forward to 2021, so every donation or every blood donation you make, you can potentially save up to 3 lives. So imagine this, if you are a donor, you're not just a donor, but you become a hero, that you can save not only one, but 3 lives when you do such donation. So by giving blood, of course, it gives us, like, extension for some lives who are in need. And in this year also, they encourage that the blood donation costs for you nothing, but it can mean to someone who are in need. Because in donating blood, or if you donate blood today, or on that theme, or in that year, so everyone who needs it ends their suffering, like for example the lack of blood. Moving forward to 2022, their theme is give blood, give or give sorry the World Blood Donation Day has this theme of donating blood is an act of solidarity. So a lot of people are joining that effort to somehow gives hope to someone who are in need. And yeah, it's a realization also that for all of our donors, that a few seconds someone needs blood, so from emergency to treatment, your donations can save lives. So imagine this, if not only you or some of your loved ones, your family member are in need of blood. So how thankful they are if you were there to give and donate your blood. And also, it doesn't stop, because in 2023, the theme is give blood, give plasma, share life, and share often. So this theme, the World Health, or for the World Donor Blood, or sorry, for the World Blood Donor Day, the 2023 was give hope. Yeah, again, give blood, give plasma, share life, and share often. This theme reflects the important role of blood donors play in maintaining the health and well-being of communities around the world. So we kudos and we recognize all the people who participated this event, because it doesn't stop. Just last year, 2024, the theme for the World Blood Donor Day is 20 years of celebrating giving. Thank you, blood donors. So, of course, we won't miss to recognizing those donors that become the hero for those patients who are in need. So, of course, we have to consider that blood donation helps saves lives, to introduce the risk of heart disease, and of course to ensure a steady blood supplies for those someone who gives and donates blood. So now, this is the most exciting part. The World Blood Donor Day of 2025. I guess today. Yeah, so for those who gave and for those who donated their blood today or earlier than today, thank you so much for being part of the celebration. Yeah. And I hope that you will do continuously this kind of honorary, or this kind of honors, or this kind of um, heroic deeds that you're doing. So let us continue. So the history of World Blood Donor Day, actually it established by the World Health Organization in 2024. So last year we just celebrated the 20th year of having this every year. This is a this is to commemorate the birthday of Carl Landsteiner, the Nobel laureate who discovered the ABO blood group system, and to promote voluntary blood donation globally. So, because of this momentous celebration and reminder for us that every year we have to participate in giving blood, because not only one lives we are going to save, but a lot of lives that we can help, most especially to those who are in need. So, why World Blood Donor Day is important? Because it raises awareness about the need for safe blood supplies, encourages voluntarily blood donations, and acknowledges the life-saving contributions of blood donors in saving countless lives worldwide. So this is not only you, this is not only your family member, this is not only the people you know, but someone who are in need of blood. Because of your effort, you can save their lives. So I hope you would always be reminded that, yeah, let's do something, let's do good, and let's help everyone for to save lives. Yeah. So blood donation and health. So this is the blood donation is not only help saves lives, but also offers potential health benefits, most especially you as donors. So what are those benefits? It stimulates the production of new blood cells, reduces iron overload, and lowers the risk of cardiovascular diseases, and promoting overall well-being. So imagine this. If you're not aware of this, you're just giving or just saving lives or just helping people who are in need. But because you just donated, it not only saves lives of others, but it saves lives of your own, and it helps your health as well. So how? So because yeah, if you give blood, of course your cells or your blood cells will be stimulated, and it gives more production. So that's a healthy way how you can recover, or how you can get a new new sets of blood within your system. And it helps you. Some of our diseases, or at times they said it cleanses your body holistically by donating blood. So again, it's not only that you save life of others, but also it helps yourself, it helps your health as well. So let's keep on donating blood. So how often can you donate? I guess it was discussed by our early speaker. So this is again a new points for you, like either you're a female or male donor. So every 16 weeks you can donate blood if you're a female, and for male and every 12 weeks. So this is the difference. So for females, they can donate at least 3 times in a year. However, in males, they can donate 4 times in a year. So always remember that, to make your blood health or to prevent some of the underlying disease, female audience here in this meeting, you can donate 4 times in a year, or you can save a lot of lives in a year by giving or donating blood. Okay. So, blood donation and emergency situation. Yeah, we all know that in blood donations, we play an important role, most especially to our who are in need. How about for emergency situations? Imagine this, that you have a loved ones or you have a family member, either your parents, your mother, your father, your siblings, your grandchildren, your daughter or your son experience in this or being in this situation. So what if someone you know or your loved ones needs an emergency blood donation, or an emergency blood donations or transfusion? So in the situations like natural disasters, a lot of disasters are happening all over the world. There are some cases that we really need bloods. For the situations also like accidents, car accidents, like vehicular accidents, or natural accidents that somehow or someone might get injured and needs blood. So imagine this, if that someone is your loved ones, and there's no enough bloods in a certain hospital or no supplies of bloods in a certain medical institutions. So if you donated blood, that somehow can help them recover and somehow help them in their medical situations. Or for those in situation with mass casualties, also where there is an increase of demand of blood to treat critical injuries and saves lives. So we never know. What if it happens for us? What if it happens to our loved ones? So I hope that everyone here, nurses, most especially nurses, or everyone who are in the meeting, we can spread the news, or we can spread, or we can encourage everyone to, you need to donate blood, because we're not just saving lives, we're not just helping ourselves, we are helping a lot of people. But in medical scenarios or in medical situations, we have to consider that some peoples are not accepting bloods. I can't answer you physically, but I don't know if you can share in the comment section or in the chat room here. Yeah, not all of the patients are willing to receive bloods. Who are they? Like those Jehovah's Witness. Um, to share you my background, my family. I am not Jehovah's Witness. I am not baptized as Jehovah's Witness, but my family background is a Jehovah's Witness. Some of my family members are Jehovah's Witness, and they don't they don't accept blood transfusion. So it is always during our nursing careers, or in our school during our nursing times, or in our bachelor in our school, that we have to consider that if someone needs blood transfusion, we have to check if their religion, if they are Jehovah's Witness, they're not accepting blood. And for some Jehovah's Witness, you can see this form, if you can see the white form in the right side of the presentation. So they have that, at times they have that in their wallet, that whatever the medical situation, you have to check first um if they want the blood transfusion. And why? The question is because Jehovah's Witness abstain from blood transfusion due to their interpretation of biblical scriptures that prohibit the use of blood or sustenance or blood transfusion. They believe that blood represents life and that God has ordained ordained that is not used for eating and sustenance. So Jehovah's Witnesses are not eating blood and do blood transfusion. This prohibition extends to both whole blood and its primarily components. So, yeah, again, we encourage everyone to donate bloods for someone who are in need, but we have to consider and respect also people who are like having this kind of religion, like Jehovah's Witness religion, because they are not keen for blood transfusion. So I guess that's for my presentation, but I know it's really hard from the start, and I know it's really hard to encourage everyone to join or to donate blood because of some factors. They are fear, they're afraid, or they are, there are some medical conditions that we have to consider. But for some who are eligible, for some who are, who are qualified, we can still continue to donate blood to save life. And yeah, we acknowledge some of the factors that needs to be considered, but yeah, we just have to start. We just have to encourage everyone. We just have to motivate them, because you don't need to have. I mean, you don't have to be great to start. You just have to start to be great. So everyone who are afraid, I know start or the in the beginning it's really hard. The starting point is really hard for every steps that you climb, for every mountains that you climb. But no matter how small you start something that matters. And for some blood donors that are here today in this meeting, we salute you, we kudos, and congratulations for taking part of saving the lives of many to be part of the saving world. Because many will start fast, few will finish strong. So imagine this: if I know you are in need, emergency situation might happen, and you are the one who are in need of this blood donation. So imagine this, that someone gives you or you give to someone to save their lives. And don't fear of anything. Just go on and believe in yourself, because just do nothing, it's impossible. But if we go together, just do it, nothing is impossible. So thank you for this opportunity again. And
Much, Mr. Benji, for your time and effort to make it for this webinar and to encourage all of us youngsters for blood donation. We are grateful and privileged to be a part of your presentation and listen to your words. We'll move on. Our next topic is innovation in blood donation. And our third speaker for this evening, Mr. Justin, unfortunately could not be able to make it today due to unforeseen circumstances. But we have Dr. Puvaneshwari ma'am with us today. Dr. Puvaneshwari is no stranger to us, as she has been the presenter for our previous webinar for Nurses Day. For those who don't know, ma'am, let me introduce her to you. Dr. Puvaneshwari is currently an assistant professor in the Department of Medical Surgical Nursing, University of Bisha, Saudi Arabia. Ma'am has completed her Bachelor's of Nursing in KG College of Nursing, Chennai, and Coimbatore, Masters in MMC College of Nursing, Chennai, and her PhD in National Consortium affiliated to INC RGUHS. Madam is a gold medalist and a distinction holder in all her academic performances. Dr. Puvaneshwari is also a program coordinator for the MSc Nurse Practitioner in Critical Care, the course at Narayana Hridyalaya Hospital, Bangalore. Ma'am has participated in over 80 state, national, and international workshops and conferences. She herself has more than 23 years of teaching experience. We welcome you once again, ma'am. Over to you.
Thank you, Tanya. Thank you, Nurseslab, for again giving me an opportunity to talk. It was a very short time to prepare. Maybe we could do it. So without taking much time, I will get into the topic. So, yeah, as a continuation of today's Blood Donation Day, we have seen the different topics like global health and blood donation and related to donors. We had a discussion, and this is something about the innovations in blood donation. As we all know, innovation is inevitable in all the fields. So today, here related to a blood donation innovation, there are a few topics which I have tried to express to you. One is mobile blood collection units, drones which is used for a blood transport, and artificial intelligence in blood donation, data analytics in blood donation, and technical driven donor engagement, augmented and mixed reality, and safety and testing innovations and artificial blood. As the first speaker said, there is no artificial blood. Yes, we accept there is no artificial blood, but there are some research they started doing. So with that, I have just put this word. So don't think it is controversial thing. No, it is under research. So what do you mean by blood donation? If you look into what is blood donation innovation, it refers to the new technologies. Like everywhere we use new technology, there are different strategies and tools which we develop to improve how the blood is collected, stored, matched, and delivered. So this is up to delivery, which is like they need to look into the safety, efficiency, and accessibility. So all these criteria, when we are trying to fulfill with an innovation, really it is very good for a life-saving measure. The first one is mobile blood collection units. We would have seen this mobile blood collection units. So this is a specially equipped vehicles like vans, buses, trailers. They designed to conduct the blood donation drive, especially when they're having a camp. They take this and go, and especially in a remote or a high demand areas. As the first speaker said, it is very difficult to even know give a blood to the primary health centers, which is very, or a tribal area which is very away from the cities. Even she had given an example of Odisha. So with that, no, there are a lot of difficulties. So in those areas, this blood collection units really it will be having a good help, especially when it comes with the mass accidents or something too. So when they have this mobile blood collection, yes, which is already there, but there are some things, some technological features need to be focused more, like temperature control storage. As we know, the cold chain system to be followed in all this blood no, safety, and the quality of the blood to be maintained with some storage temperature like 1 degree to 6 degree. If it is above 10, 20, so that's it cannot be stored properly. It will be a waste. The blood cannot be used for the public. So the temperature control system is also maintained in this mobile blood banks, automated registration. So this is an advanced one. So here, like a digital donor management system. So when the donors are giving the blood, they maintain it digitally, and QR code is based on registration. All those things, they do it in the mobile blood collection units itself, and touch screen kiosks. So these are all some of the advanced innovations. Onboard screening, they do a hemoglobin testing, BP monitoring, and basic donor screening in the mobile van itself. Real-time data synchronization, and they integrate this mobile blood van or a vehicle with the central blood bank database also. So with that technology, really it is like an innovation. So as I have told, it is already there, but the recent innovations are like solar powered units. So they maintain the refrigerator and all the devices. They need an electrical circuit or a power. So for that, they use a solar power, and paperless e-forms, which is help for speeding up the processes and reducing the errors. So they don't, like nowadays, everything is coming digitally. So here also they maintain a digital process which reduces the error. Telemedicine integration. As we all know, telemedicine is like the doctor consultation is away from the person. The similar way, here also the remote doctor consultation for the clearance of the donor. So that they do it digitally, and that will be helpful for a remote area. And artificial intelligence driven route optimization. So this will be helping to predict the donor rich areas and demand the cluster. So these are all the things which is like coming as an innovation in the mobile blood collection units. Next one is drones for blood transport. So we all know drones are used in every area. Similar way, they transport the blood, especially the very rural area or a tribal area or a hilly area. They use drones for that. So it is used in countries like Rwanda, Ghana, India. There are a lot of evidences, even in India too, related to the drones for the blood transport. And definitely it is helpful in a rapid delivery in the emergencies and bypassing especially the poor road service when there is a natural calamities. All those time it is very difficult to take the blood to the particular area. So drones are very, very helpful, and it supports the trauma care, maternal health, and to the rural hospital, as I said before. And one of the thing, like there is a project, Medicine from the Sky. So this particular project is done by the Telangana government. I think it was in the year of 2021, if I'm not mistaken. So there is like a collaboration with the World Economic Forum, Apollo Hospitals, and Red Wing Hospital labs. So with that, they're trying to do this drone delivery of blood. So it works like they collect the blood from the central banks and go to the primary health centers, especially the remote villages, and they maintain a very good cold chain system. So it definitely reducing the time of delivery of blood to the central blood bank to the particular area. Like they have given like 2 to 3 hours to 15 to 20 minutes. Really, like in emergency situations, these drones are very helpful. So it is an innovation which is already practiced in India. And next one, AI in blood donation. So when it comes with artificial intelligence, there is many things it has. One is called like predictive shortages. That is something like before it happens, it is predicting how much amount of blood we needed like that. So it helps to analyze the past donation trends, hospital usage, as well as the seasonality, especially dengue. When there is a prevalence of dengue, when there is a prevalence of malaria, blood donation is needed more. So in that situations, it's try to predict it, and it is tell us how much blood we needed. So we try to go for a blood awareness camps and other things, try to get a blood from the donor. So definitely it will be helpful for other coming publics with the different issues. Forecast the blood demand as well as the shortage. So the benefit is like prevents the stockouts, optimizes the donor drives, and definitely it reduces the waste from the expired units, because sometimes blood is like we cannot keep it for a long time. Each component has its duration. So it tries to predict, okay, these many bottles are there, these many things to be. Anyway, manually we do. Normally we do in blood bank, but still this is giving you a predictive examples or issues. And there is one thing that is Erect Coach, which is there in India, and NHS in UK. They use AI for real-time stock alerts and demand forecasting. So in India, we are using. So this is a picture of that particular app, National Health Mission. With that, they do this predictive shortage. And data analytics in blood donations. So this is also with the integration of the same app. So here they have a centralized database which captures real-time data from over 700 licensed blood banks. So here they helps to track the blood availability, utilization rates, and geographical needs. So depends upon the area, the seasons. So they try to give the blood to them and identify the donor retention trends and dropout patterns also. So the performance monitoring mainly it analyzes the donation drive effectiveness. As there was one question in the chat box I saw while doing the just checking. So someone asked how to improve the blood donation, how to. So it is mainly an awareness camps which we are supposed to conduct. So this will be helpful for us to know understand about the public, even their mentality, their attitude. So we can go and talk to them related to their misconceptions, like how the previous speaker spoke. So those things definitely increases the rate of retention or identifying the donors. So those things will be helpful, and even this data analytics are helpful in quality control through audit trials and compliance monitoring. So these are all the some of the important things which is working nowadays with the data analytics in blood donation. And AI is helpful in matching the rare blood types too. So this is another important one. So it identifies and matches the rare blood group using AI, and it analyzes the donor genetic and phenotypic data. So this will be helpful to quickly identify the rare blood groups and try to inform them so we can get from the particular central blood banks. So this is a very important thing, saves the time and builds efficient and rare donor registries. But for this, all the tie-up blood banks also should have this AI, artificial intelligence applications. Then it is really good. In Japan, there is a Red Cross and American Rare Donor Program. Like those people are using this AI for fast rare donor matching also. And technical driven donor engagement. So nowadays we all use mobile and we all have different apps. Like, so there are a lot of mobile apps and e-platforms. Here some pictures I have given, like a Simply Blood or Friends to support, like that different connecting donors apps are there, and recipient, like they can have a connection. And main features are location based donor matching, urgent request alert will be coming, so immediately people will respond. Even that Odisha incident also, it was told like the doctors have created in WhatsApp and immediately they inform the volunteer donors, within 4 hours they receive the blood. So that urgent request alert is given to them. So those innovations are already existing in India. And faster response in emergencies. So this helps like increased voluntary donation and wider donor network reach across regions. So these are all the some of the benefit out of this mobile apps. And so these are all the different mobile apps which you can see when you're going through your Play Store too. And augmented and mixed reality. So this is something like virtual reality. So this is mainly helpful in educational aspect of blood donation. So like you can see this Microsoft HoloLens. So the people can use this, like how it will be, because there are a lot of misconceptions are there, like whether the infectious disease will come to me, or it will be very painful, or I'm very anxious. There are a lot of things. So young donors or like they have a lot of doubts about it. So they use this augmented and mixed reality to clarify their doubts. That helpful for them. So they will not feel much anxious before they come for a donation. So especially it is difficult for the first time donors. But once they have donated, they don't have any issues like that. When they feel, they continuously give like 2 times in a year, or yearly once, like that. It depends upon their willingness. So for that education, we use this augmented and mixed reality because it will give a real life feel, and they can have the 3D dimensions vision. So with that, they will understand a better way. And another important concern of or a challenge we saw in the previous presentation is safety. So safety is an important thing. So now they are bringing the different techniques like pathogen reduction technology. This is something about in the lab they do it. So this main aim is to inactivate the viruses or a bacteria if it is present in the blood. Especially like we have a lot of viral infections like the hepatitis A, B, HIV, all those things. So it is still in the process. So there are different techniques they use, like amotosalen and UVA light they are using, try to cross-link this DNA and RNA for its prevention of its replication, or ethylene blue plus light. So like that, multiple innovations in the pathogen reduction technologies. So definitely it will be helpful for a safer blood and reduces the transfusion transmitted infections. Even there was like 70,000 to 80,000 HIV infections are transmitted globally because of the blood transfusion. So it's a very big number. So it can help to prevent those type of things. So it is very important. And advanced testing and storage solutions. So there are, for enhanced testing methods, they use nucleic acid testing or a NAT testing. So this is helpful. Like normally we do a traditional test, but other than that, it can try to understand the HIV or hepatitis B earlier than the traditional method. So that is a latest trend they are using, molecular typing and improved storage solutions. And as we have already said, like each blood group or sorry, each blood component has its own duration, its lifetime. So this additives can help to extend their lifetime. So we prevent wastage of blood. So these are all the some of the innovations they are trying in the safety and testing. As we told, the last one is like artificial blood. So what is artificial blood? This is the lab is developing the blood. It like mimic the real blood, especially the main function is oxygen. So that is what we are looking into or transfusing a blood. So the blood's oxygen carrying function, this artificial blood will try to do it. It is designated an emergency for 1 second. Okay. Emergency use when matching donor blood is unavailable and it is an emergency state. So in that time, can we use it till the real blood or the human blood comes? So in that way, there are things, but it not coming to the practice as I know. But there are different types of researches going on. Hemoglobin-based oxygen carriers, that is modified hemoglobin for oxygen delivery. So this is a research project. And perfluorocarbon-based substitutes. So they use a synthetic chemicals that dissolve and transport the oxygen. So it's not exactly a blood, but it does the function of the blood. So that's why they call it as an artificial blood. As a conclusion, overall, whatever the technology we are using, so that we are telling that the innovations are very helpful in faster and safer donations, better donor-recipient matching, and it has expanded access to remote areas. That is the main function, like a drone delivery, all those things we have that, or a mobile apps or e-platforms. These are all very, very important to reach the blood to that particular area as early as possible and improve the emergency response and outcomes. So these are all the different ways these innovations are helpful. So this is the innovation we are just reading in 2025. So maybe another 5 years, the innovations may be a little more different. Anyway, I don't know how many of us have donated blood. Hope this presentation with all three presenters maybe will motivate you also to donate a blood. There is no fear in donating the blood for the blood donor, and wish you all the best maybe to be a blood donor, and thank you for the opportunity. Any clarifications you can ask.
Thank you, ma'am, for the insightful information on innovations of blood donation. Despite it being a last resort, you have definitely covered an extensive point of view of various innovations in India as well as in the world. Thank you, ma'am, for that.